Hello, everyone, and welcome to another episode of Visionary Voices, a podcast series by To The New, where we bring together industry leaders, innovators, and technology experts shaping the future of digital transformation. I'm Arpit Miglani. I lead partnerships for To The New, and today we are exploring one of the most important shifts happening in healthcare. The journey of AI from experimentation to the real-world impact, as organizations move beyond pilots and begin embedding AI into operations, clinical workflows, and patient experiences. The conversation is increasingly about scale, governance, and measurable outcomes. Joining me today is Gaurav Singh from AWS, a principal solutions architect with more than 21 years of prior experience in technology architecture. And he works closely with healthcare organizations navigating exactly this shift. Welcome to Visionary Voices, Gaurav.
Thank you so much, Arpit. I'm really glad to be here today, and thanks for inviting me. I'm looking forward for the conversation.
Great. So let's get started with this. For years, healthcare AI has lived mostly in pilot programs. What's different today that's enabling organizations to move into production at scale?
Yeah. So, Arpit, if I see 3 years ago, providers, they were spending a lot of money in terms of building custom AI models using a traditional AI way of development. And the idea was to solve a very specific problem. It was not solving across the complete operations or clinical, right? And mostly it was the investment was on the clinical side. But now, if you'll see in the last 3 years, what has happened, the models are already there. Now we have the technology. Gen AI models, they are really great in parsing medical information. They can even ace the medical tests and exams. And they can understand the unstructured medical data as well. All right, so now the technology is there. Now, the problem which currently is there is, how do I bring that technology to my existing workflow? So the data is also becoming structured slowly. There is a mandate from government to adopt digital solutions for your healthcare. So we are moving away from paper. Still, there are multiple disparate systems. There is a EHR, EMR systems, there is a PAC system, there is a lab system, which might not be talking to each other, but still they are digital in today's age. But as interoperability is now coming into the picture, adding these solutions, adding AI into the existing solutions is becoming easier. And that's where we have started seeing the adoption is happening now.
So from having a lot of foundational LLMs model which are there in the market to building small verticalized, SLMs, how do you see, where do you see partners, the AWS partners can come in and help customers enable that production at scale?
Sure. So generally what we see is with the providers, which is our hospital ecosystem or even the laboratory management systems or diagnostic labs, right? The IT teams, they're very good with building softwares, but they lack a little bit of domain knowledge in terms of how to innovate and how to use that domain knowledge, where these AI models are now helping. Our AI model bring in that domain knowledge as well. What we want partners to do is that start investing time, analyze the existing systems which the customers are running, and then educate them how their existing systems can be upgraded with AI. So do not bring a separate AI tool to a provider. Analyze that existing platform. If it's a EMR system, if doctor is taking a consultation, and on that particular consultation screen where we can add the bits and pieces of AI so that doctor does not realize that AI is doing something, but it is saving, let's say, 5 minutes per consultation. And if a doctor is doing 10 consultations in a day, that means we are saving 50 minutes for that doctor, which means he can now see at least 3 or 4 more patients. So that's where we start bringing in efficiencies. So the partners can play that role. On your SLM question, yes, if partners have the domain knowledge and they can fine-tune these large language model to solve a particular problem in healthcare space. I will not go to the diagnosis part or the clinical part, but still in the operational space, maybe building an SLM which can analyze a health insurance claim before it is submitted. If those tools can be built, they would be really value add to the providers. It will reduce a lot of false claims. It will reduce a lot of back and fro with the insurance companies. So these tools can really help.
When you look at successful healthcare AI deployments that you might have been part of since your tenure with AWS, what separates the organizations that scale from those that remain stuck in experiments?
Yeah, so I think it's the approach that an organization takes when they start looking into adopting any new technology, and specifically AI. So what I have personally seen, if I compare multiple providers where I've seen success and where I'm seeing that success is still a little far away and they are taking baby steps and not at that pace to achieve an outcome, is that an organization where I've seen successes, they start with very complex problem. They pick one very complex problem which is giving them a lot of pain on a daily basis. Then they define a KPI to measure. If they implement, they will solve this problem, how they are going to measure the solution. Then they use an existing platform. They do not reinvent, they do not create a new solution, because the users who are using the particular solution on a day-to-day basis, they do not need to be retrained on it, right? So they pick the existing solution, and then they also involve their leadership in it, right? And then they do an auditability and traceability to prove that once they have implemented it, they can prove it as doing the right thing for them. So once they have all these 4 things in place, I've seen success happening much faster. I'll give you an example. Let's say one of the provider wanted to build a progress notes app for their doctors when they do a round in the hospital wards. Currently, they walk with the junior doctor, they say something, junior doctor takes a note, but it takes a lot of review after it is done. Doctor has to review what was transcribed at that point in time. So it was decided, why not we build an app where doctor can simply speaks and it synthesizes and keeps it ready for doctor to review, right? So that every other person who is with the doctor also gets that knowledge and focuses on the patient rather than focus on taking notes. And that's where we have seen, because the doctor was involved, they were not building a new software on their existing application, mobile application, which the doctors were already using to write prescription. They added a button to simply record what doctor is saying so that it can be transcribed. And then they were able to measure that on a round, when they were seeing 10 patients, how much time and the quality of the progress notes that they could bring in, right? And then once they identified, okay, this is much easier, they rolled out to 10 doctors, then they rolled out to 50 doctors, and it becomes a really something which doctors were very easy, they were finding very easy to use. And then they decided, okay, we have solved one use case, why not we do a same thing for a nursing handover? Once a nurse finishes her working hours, let's say 8-hour shift or a 10-hour shift, when she has to go, she has to give the complete handover to another nurse, right? So before going, she can simply speak about all the patients and it structures all those notes, and she just have to read, review and approve it. And that would have saved at least 45 minutes for every nurse in the evening or in the morning to do that handover. So they picked up the very complex problem, they involved the people who are there, they did not reinvented the application, and then they tested it very aggressively, and then they fine-tuned it. So that is one approach where I've seen a success happening. And the organization where you see the success is not happening is that they first invest in technology. They bring in, they buy, okay, I'll buy a subscription of this AI tool, which is a SaaS-based tool or maybe a locally installed tool. And then they go and then figure out what should we solve with it. And that's where it always remains stuck into the pilot phase.
But what we have seen, when we have reached out to these kind of enterprises, right, there has always been a discussion on saying, AI has become a costly affair. Right? How do I rule out that time versus money question, when these enterprises talk to us about this?
Yeah. So time versus money is automatically handled when you address those problem areas which has got a scale into it, right? The example which I gave, if there are 50 nurses in a hospital and every nurse is saving 45 minutes, just amount of time saved, right? Probably that was her personal time. She was not supposed to be in hospital. She might have to spend that extra 45 or 1 hour in an hospital so that she can ensure that the patient safety is there. The new nurse who has come, she knows what to do next, and she can go and probably spend that time wherever, maybe relaxing, coming for the next shift, right? All of that. So you have to pick up those problem statement which impacts the staff productivity at a very large level, right? If you'll pick, for example, I start implementing a solution which is to identify a rare disease, right? Now in a hospital, that could happen once or twice a year. And the technology, the amount of money that would have gone in building such LLMs or such AI model would have taken thousands of dollars, or it can go up to millions of dollars. So there, realizing ROI could be challenging. But if you think from hospital operations or healthcare operations, use cases are immense where you can see the value and the cost it brings down. I'll give you another example. We work with the government of India, right? And there is a very large health insurance scheme which runs in India, right? And it serves about 500 million population. Now, it's a process where every hospital sends a claim to government, and then the claim is reviewed by a doctor, and then it is pre-approved for the treatment and all, right? Now, to do that manually, the SLA was 6 hours, and a large team of doctors which are going to review it, what treatment has been advised, does it gets covered into the policy or not. Now, the same process, we help the customer to implement AI there, where once a claim comes in, the AI agent can pick up the claim. It reviews the guidelines of the insurance policy, and it checks whether all the documents are there, and is the treatment is aligning with what reports are suggesting. And then it can say, okay, this claim can go pre-approved, or if it finds some gaps, it can put it for a more information, or if it finds there is a discrepancy, it can outrightly reject that claim, right? So now if you're doing 12,000 claims a day, so you can imagine the amount of money saved in terms of human hours and the time saved to start the treatment, right? Most of the hospitals, they will not start a treatment before the pre-approval has come, pre-auth has come, right? And on the hospital side also, if it's a provider, it's a private hospital which does 500, let's say, admissions in a day, right? A large hospital chain can easily do that. And that means out of 500, at least 450 insurance claims would go. Now, if I have an AI and that system's baked in, which can review my claim before I submit it, so that can save a lot of staff hours for me.
Wow. The two examples that you had given, one is the nursing one, and there was another on the claim settlement, or how do we optimize that. So both of them, I think, are into two different segments. One is more clinical side of it, the other is more on the operational side of it, right? So what we have seen when we talk to these customers is the clinical one takes much of a spotlight than the healthcare operations. What's your view on that?
So it was the case a few years ago. Again, when I started, I said that because the providers, they were clinicians, they were senior doctors, oncologists, they had a lot of data, and they always felt that, okay, let's invest time and give our domain knowledge to help build a model which can predict what kind of a cancer it is, or how to, if it's a rare cancer, what kind of a treatment or a medication could be applied. Those are very fancy use cases. And again, the ROI, justification of ROI for a smaller hospital or for a medium-sized hospital could be very difficult here. But when it comes to operations, right, there the AI works in the background. It's not in the limelight, but the amount of time that it is saving, the amount of efficiency it is bringing, the amount of errors, human errors it is helping you avoid are tremendous, right? So that's what we are seeing in the field, right? When we go to these hospitals, when we talk to them on the use cases, now they are prioritizing how they can improve these efficiencies, because then there is a recent study which has happened for the Indian healthcare system, which says about 40% of clinicians, they have shared that they're using AI in their day-to-day operations. And now that AI is not directly involved in the clinical side of things, or diagnosis, or suggesting a treatment. It's helping a doctor doing his documentation. It's helping a doctor doing a research. It's helping a doctor to see the summary of the patient when a patient walks into it. Just imagine a hospital in Delhi and patients currently, even if they book an appointment, they might have to wait 15 minutes, 20 minutes. And once they enter, they have to explain what is the condition, even if they are returning patients, right? Or doctor will have to go through the previous medical records on their EMR system. Now, AI here, when a patient is walking in, knows that this patient is a returning patient. Doctor see another section there with a summary that this is the chronological order of the treatment that this patient has received. So that's where now the AI is shining. Speech to text is a very, very strong use case where we are seeing that doctors, even in Indian context, there are local languages, Tamil, Telugu, Kannada, Marathi, where now these LLMs and speech to text models, they are able to very accurately comprehend what doctor and patient conversation is happening and giving you a structured prescription, which doctor just have to approve that, okay, it has captured all the information correctly. And then there is an auditability also, right? Doctor can see, okay, it says that I have prescribed 3 medicine. Doctor clicks on particular section and it shows this is the conversation section from which I have picked these medications for you. So it is building a confidence. And definitely clinical use cases will be served by AI very soon, right? But in today's time, I think the maximum ROI that a provider is getting is from the operational use cases.
I see a benefit of that. It creates a transparency with the patient as well, when it comes to understanding what doctors are saying using those notes, right? So that was more on the business side that we had talked about. Coming to the technology, for years AWS has helped organizations in setting up their infrastructures on cloud, giving them a good compute. So what does the AWS healthcare stack actually do for a provider, that a general cloud setup can't do?
Yeah. So I'll start answering with that question from the AI perspective itself first, right? So if today you have to do AI needs a lot of structured data or a semi-structured data. So when you want to use these models are available in the cloud infrastructure. So for example, Amazon Bedrock is an orchestration layer where you have multiple LLM models available. You can bring in your own models on Amazon SageMaker. You can bring in open source model on Amazon SageMaker or SageMaker Jumpstart. Now to consume this, either you have to bring these models to your data or you have to take your data to your cloud, right? So most of the providers, they were running either on-prem or in the co-located facilities, which is kind of a barrier because now model is in the cloud, there is a firewall in between, your data is on-prem, right? So what I have seen in the last 2-3 years is providers have understood that they need to go onto the cloud to leverage the AI first, right? So AWS was already solving that problem of compute, infrastructure, storage, networking, and security for you. Most of the services where you are storing your data or the data is getting exchanged are HIPAA eligible services. That means it is these services are designed to cater to the healthcare industry. Now, because AWS understand that there is a lot of innovation which needs to happen, healthcare organizations, they are primarily driven to give care at the end of the day. They are not technology companies. So if I have to solve an healthcare data interoperability, why not AWS invest in building a service which will give you a FHIR-based healthcare data store, which means the new solutions that you are adopting, a new HMIS platform or HIS platform, which understand FHIR, AWS has a service called Amazon Health Lake, right? Now, if the patient data is in a FHIR format, it's very easy to unlock AI use cases on top of that data. It's very easy to do chronological, longitudinal health records of a patient. It's very easy to create a summary of what patient has gone through his lifetime and bring in those nudges. So we have medical comprehend, which can understand the medical terminology in the doctor's notes in unstructured data. There is Amazon TextRock, which can extract data from the scanned documents. Right? So there are a lot of services which are available, and most of our partners and most of our customers, they leverage these services to fast track the development. Very recently, I've been working with one of the client. They are building a very small clinical application, which we are showcasing them how they can directly build on top of Fire as a data store format. Which means that they do not have to worry about defining the data structure, their custom data structure. Because once you define a custom data structure and you need to interoperate with the ecosystem, you again have to create a layer where you now need to do the conversion between your custom data structure into Fire. Right? So why not build directly on top of Fire and then get maximum benefit of AI also, because now your structure data is ready for AI to search, consume, comprehend, summarize and everything.
So for leaders in the healthcare industry, like people who are sitting at the business in the tech leadership positions at healthcare organizations, what's the one thing that they should be doing differently in the next 6 months or a year time?
Yeah. So there are two things they should be doing, right? So first thing is that if they are not using a cloud infrastructure for their clinical application, their core databases, their data lakes, health data lakes, they should try and plan a migration and take that application, that data layer to the cloud, because then they will be closer to these models and integration would be much more simpler and easier. Otherwise, just imagine bringing these models to your own data centers. How much compute, how much GPUs you would invest, right? You will not be able to do innovation. You will only be doing the procurements. So if you are already on the cloud, I would suggest pick up one very complex use case, identify the stakeholders, define the KPI, how you will measure if this problem is solved. For example, we were taking the nursing handover, right? If I am able to save 10 minutes or 15 minutes of nurse time every day in the morning and the evening, what is the bandwidth I'll going to free up for my staff? And then how I'm going to audit it, what AI is doing is right for me, right? And I do that, experiment it quickly, roll it out. Don't just keep testing it internally. Involve your end user. Get a feedback, roll out. And once you have one department approving it, you will have a demand for that tool across all your departments. And then you will move to the next use case and the next use case. So do not create a very massive AI strategy. Start small, implement it, show the result, move on to the next one.
Thank you for joining us and for pulling back the curtain on what it actually takes to scale healthcare AI, from the AWS perspective.
So thank you so much, Arpit. I really enjoyed the conversation, and I'm really looking forward for partners like you to build up these capabilities where we can jointly work with the providers and help them innovate much faster, rather than they struggling in-house and you coming in as experts of implementing these solutions, and we can do wonders there.
Thank you, Gaurav. To our listeners, thank you for joining us on Visionary Voices. Stay tuned for more conversations with industry leaders who are shaping the future of technology and innovation. Until next time.